tired.
Yeah, I'm tired too. See what's on the news.
Yeah, I can't study anymore.
Good morning, viewers. I'm Ashley Tuttle.
I'm Susie Kim.
And today on Sunshine 2 News, we have a special broadcast talking about a pandemic disease state that has been affecting populations for decades. It's called HIV, or the Human Immunodeficiency Virus, and one might say it has gone viral.
Now, Ashley will uncover the prime suspect of this infectious pandemic.
The suspect behind the HIV disease state is the Human Immunodeficiency Virus. It's classified as a retrovirus, meaning that it is replicated by means of converting its RNA genetic material to DNA, a process called reverse transcriptase. Seen here is the virus in action. On the outside is a double layer of phospholipids called the viral envelope. Within this viral envelope, there is a protein capsid, which holds the RNA genetic material of the virus. On the outside of the viral envelope is glycoproteins, which are composed of two molecules, GP120 and GP41. These glycoproteins bind to CD4 receptors on T cells of the host cell. Once bound, the RNA material is able to enter the host cell where it can begin the process of reverse transcriptase. Back to you, Susie.
Courtney will discuss the pathogenesis and immunity and clinical diseases associated with HIV.
Hello, I come to you with a segment on pathogenesis and immunity and clinical diseases. So pathogenesis is defined as the start of a production of a pathogen through its life cycle. Immunity, however, is how the body responds to any breach in the sterile environment caused by a pathogen in the system and what it will do to get rid of it. Clinical diseases, unfortunately, are the result of what happens when there is an unsuccessful elimination of the pathogen in the body. HIV infects the mucosal surface by entering and rapidly infecting mucosal-associated lymphoid tissues known as MALT. HIV will go after the immune system by destruction of the CD4 T cells, which causes these cells to not be able to survive the pathogens. Dendritic cells are the first cells that bind to the HIV pathogen. It then carries the pathogen to the lymph nodes to the naive T cells. Unfortunately, the virus binds to the CD4 receptors on the T cells and begins to insert its RNA genetic material. B cells will not become activated by the T cells, which results in the T cells being cytolized within the lymphoid tissue. This leads to inhibited adaptive immunity. A reduction of the immune system leads to a clinical disease known as AIDS, which stands for an autoimmune deficiency syndrome.
Thank you, Courtney. Now Liliana will join us to explain the treatment and prevention options for HIV, as well as the epidemiology associated with HIV disease states.
Thank you, Ashley. So who can be affected by HIV? HIV can affect anybody regardless of gender, race, or ethnicity. Who's at higher risk of being infected with HIV? People who are having unprotected sex or people who are sharing infected needles. There are approximately 1.2 million people infected with HIV in the United States. Of these 1.2 million people, 1 in 8 of them are unaware of the fact that they have the infection. Gay and bisexual men account for 67% of people diagnosed with HIV, while heterosexuals only account for 27%. People who share needles account for 6% of people who are infected with HIV. So this graph demonstrates that Black men who have sex with men are most commonly infected with HIV, then white men who have sex with men, then Hispanic Latino men who have sex with men, Black heterosexual women, Black heterosexual men, then Hispanic/Latina heterosexual women, and the least is going to be your white heterosexual women. Since HIV is a virus, there is not a cure for HIV. There is a treatment option available to help people who have HIV live a longer, healthier life. This treatment option is referred to as ART, or antiretroviral therapy. People who are on ART are required to take several HIV medications or a combination of HIV medications. There are 6 different classes of drugs, including non-nucleoside reverse transcriptase, nucleoside reverse transcriptase inhibitors, fusion inhibitors, protease inhibitors, CCR5 inhibitors, and integrase strand transfer inhibitors. These medications work to prevent the virus from multiplying, which decreases the amount of HIV that's in your body. With less HIV present in your body, it gives your immune system a chance to fight off any other infections that are present in the body because it has a higher chance of recovering from HIV. So how do you prevent yourself from getting HIV? Well, HIV is most commonly spread through sexual intercourse. So the best option is to not have sex or to use a condom while having sex. Another option would be to make sure that you and your partner are both tested negative for HIV before having intercourse with each other. Another prevention option available only to those who are at high risk of getting HIV is pre-exposure prophylaxis, also known as PrEP. PrEP prevents the virus from taking a hold of the body. People who are taking PrEP are required to take 1 pill every day and see their physician every 3 months. But like I said, only people who are at high risk of getting HIV are allowed to take these kinds of medications.
Thank you, Lily. Now turning it over to Anais.
Thank you, Susie. I was able to go and interview one of our very own alumni, Dr. Rudy Yanez. Here is what he had to say.
A patient presents to you at your pharmacy with HIV and is asking how to go about handling this. What would you answer?
Well, I'd first ask the patient if they've engaged in any risky behavior in the last 6 months or within the last 6 months or so. If they've been tested recently, again, within the last 6 months. Based on what they've answered, it's something that I can further build up upon as far as testing requirements, signs and symptoms that they might present with, treatment options. Cost is usually one of the biggest things in patient assistance programs. Somebody who's newly diagnosed is going to want to know all these things.
Right. Would you know any of the symptoms that they might present with?
Initially, they're not going to present with anything drastic. It's mostly their immune system is becoming less and less viable, I guess I should say. What testing is going to do is just going to show what their viral load is. If it's detectable at any point, it's going to show their functioning immune system, whether it's been degraded or not. And at that point, the doctor can let them know how far they've progressed and what the best treatment option is.
Thank you, Anais. We now join Susie to talk about how HIV has affected us worldwide as a human population.
Thanks, Ashley. So since the start of the HIV epidemic, 78 million people have been affected. Out of the 78, 35 million people have died. And currently, as of 2015, 36.7 million people are affected by HIV. Out of the 36.7 million, 24.7 million people live in the sub-Saharan African region. That makes up 67% of all HIV patient populations. Since majority of HIV patients live in the sub-Saharan African region, we are going to focus on that region. So, how do people get HIV in sub-Saharan Africa? 80% is through sexual intercourse. 10% is by blood contact through razors or dirty needles, and the rest of the 10% is by blood transfusions. So what conditions favor the growth of HIV? The transmission of HIV is very prevalent in really poor countries. So in Africa, a lot of young women and children are forced into the sex market, working as sex laborers, which increases the rate of unprotected sex, which also increases the rate of HIV spread. Also, there's a lack of safe sex education, which also increases the growth of HIV. Finally, in a lot of poor countries like Africa, there's not enough medical facilities and doctors and nurses to take care of these patients, which is very crucial to stop the growth of HIV. So what are the social impacts caused by HIV? In a lot of poor countries like Africa, as you can see here, there's a lot of patients that are overfilling the hospitals. This causes not enough doctors and a lot of patients, and patients are forced to come at later times, which worsens their conditions and symptoms of HIV. Also, because many people are dying due to HIV, there's less workforce, less export, which decreases the nation's economy. Lastly, since people are dying because of HIV, the agricultural workforce is also decreasing, which increases scarcity of food, and people are dying of starvation.
Thank you, Susie. And thank you for joining us today as we investigated HIV, its prevention options, and its effect on the globe.
Tune in at 6 to catch the weather forecast for the weekend.
You're watching Sunshine 2
2
News.